Hey guys, how are you all doing today? My name is Edith. It's such a pleasure to be back here talking about asthma, how to control symptoms, prevent exacerbation, and then, of course, manage the disease or whatever we choose to call it. So, I have a lot of people ask me, Edith, what is asthma? How do I know if I have asthma? And if I do have asthma, how can I control my symptoms? So first of all, I want to talk to us about asthma. What is asthma? Asthma is an airway disease. It's a chronic airway disease, meaning it lasts for a long time. And then it's reversible actually. I always try not to mix irreversible and reversible. So it's reversible, meaning the individual has the disease, but you can actually stop it. So what that means is there are periods when the individual is going to have exacerbation, is going to have asthma attacks, and then there are periods when they're going to be at rest. So what is asthma? Asthma is a situation where the lungs the bronchioles that lead to the lungs begin to narrow down due to some immune response. So sometimes individuals could have triggers, and these triggers could be allergens, it could be pollen, it could be dust from the house, it could be some change in the temperature of the environment, it could be some animal danders or something like that. But there is definitely something that could trigger that reaction. So when this reaction is triggered, the immune system responds, and in the process of responding, the bronchioles begin to tighten up, so the airway begin to narrow. So when there's a swelling, there is a narrowing, and then in the course of the narrowing, there is a production of mucus, a lot of mucus, and then it makes breathing very difficult for the individual. So when this happens, what do we do? What kind of symptoms are we looking for? We're looking for shortness of breath. We're looking for chest tightness. We're looking for wheezing. So we're looking for coughing. We're looking at people who wake up and they can't go to bed. They can't sleep again because they feel like they're going to die or they're going to pass out because they're not getting in enough oxygen. So that is exactly what happens in patients with asthma. And of course, like I said, it's reversible. If you get the right treatment, if you get the right medication, if you're able to manage it, you might live for a long time without having those attacks. So which people are at risk for having asthma? Young boys especially, and then older females have been also found to have late onset or adult asthma. Now, what are things that could actually result in asthma? We have environmental factors, we have occupational factors, we have sex factors, like I said, young boys and then older ladies. We also have genetics and hereditary. So there are some people who have asthma running in their families. Yeah, those people have a higher tendency or likelihood of having asthma, having their kids have asthma. So the next thing I'm going to talk about is how do we manage asthma? How do we even prevent it? Because the goal is to help the individuals or keep them from having to have attacks every now and again, even more frequently. Because the more these attacks, then the more long-term damage it could cause to the lungs. And then, of course, the reason I'm doing this is to ensure that we prevent emergency room visits, especially now that COVID is around. We don't want to be stuck in the hospital with something that we could have really avoided or prevented. Now, there is a classification of asthma, and then it's very important that you understand where your asthma is at every particular point in time. Wherever the classification point is, that is where the treatment is going to start from. So if you have, I'm going to talk about the different categories of asthma or classifications of asthma. But if you have asthma, every single individual who has ever had asthma needs to be on a long-term medication to prevent exacerbation. Now, this program is not directed to or is not intended to diagnose or to treat. I would recommend that you contact your medical professional or your doctor, to assist you with determining which medication you need to be on for a long time. Now, the classification of asthma is based on severity. We have 4 different classifications. The first is the intermittent. Intermittent asthma is a very little bitty asthma, less than two. The symptoms come on less than 2 days in a week. People who have them are awakened less than 2 times in a month, and then they don't usually make use of their long-term medication. So the symptoms are pretty much, very brief. They don't happen a lot. And then we have the mild persistent asthma. The mild persistent asthma has symptoms lasting greater than 2 days in a week, and then it wakes the individual up like 3 to 4 times a month. And then the individuals are found to be using their long-term medications more than 3 days in a week. That is the mild persistent. Now we're going up to the moderate persistent asthma. Those have daily symptoms. So if you are having daily symptoms, then you have moderate persistent asthma. Most times they're awakened greater than 1 time a week. So maybe 2 times a week or thereabout, but at least 1 time a week they're awakened. And then they use their long-term medication daily. So you're not supposed to be actually using that medication like every single day, but if you find yourself having to use your long-term medication daily, then yes, you might need to go back to be reassessed by your doctor. Now, the severe persistent asthma is, that is the height of it. People who have severe persistent asthma have symptoms throughout the day. So they have symptoms every single time of the day. They also are awakened over 7 times a week. So like every night. And then they use their long-term asthma control medications every single day. Now, this classification enables treatment. So if you're having intermittent asthma, and then you are taking medication for severe asthma, you might be causing your lungs a lot of damage. But if you're having severe asthma and you're taking medication for intermittent asthma, you would agree with me that the medication would not be effective. So it's very important. This stepwise classification enables us to appropriate the treatment that the individual needs, and then of course makes the treatment more effective. So with that being said, if you're having symptoms at any time of the day, if you're having more frequent asthma attacks, you need to either check your environment. You need to figure out if there is something that is causing the trigger. And then you need to be also sure that you're taking the medication appropriately, because some people who take the inhalers or the spacers, we find out that most times they're not using the medication like they are really supposed to. So please try as much as possible to go see your doctor and get the right medication and get the right education for, on how to use your medicine. Finally, on a final note, every single person who has asthma needs to have the long-term medication. So if you are there and you've not been able to figure out what exactly you need to be doing, please, I would strongly advise that you go see your doctor and try as much as you can to prevent any situation that is going to trigger an attack. Thank you so much for listening to this presentation. It's been so wonderful talking to you today. I'm somewhere on my vacation, but yeah, I'm going to be doing this anyway. So thank you so much, guys. I hope to see you all next week. Until then, have a beautiful, beautiful weekend. Bye-bye.